Hello. Okay, we'll start with your mobility stuff. These two things, you can do them as often as you want. If you start to feel your shoulders a little bit tight, or even if you don't, these are great to do at any time. Seated, upper back opener. So pretend I've got a back on this chair. I'm going to get my elbows behind my head and pull those elbows back as far as you can, so retract your shoulder blades, and then just leaning the upper back. So see how I'm just moving my upper back. I'm not arching my lower back. When you do that, you're compensating. So it's just a small movement. So like a really mini sit up, pushing those elbows back, and do as many reps of those as you can, or as you want. Then the shoulder drills that we talked about, better to see from the side. Lead it with your hands and push your hands towards the ground. So I'm rotating my hands, then I'm rounding my shoulders and I'm rounding my upper back. And then the opposite, turn my hands back, keep them behind the line of my hip, and then lifting up my chest. Feel like you're almost being like pulled up by a string at the top of the head. So that's one. And you're going to go for like 10ish, but as many of those as you can really. You should feel a little bit, getting a little bit more range with each rep. So then we're going to go for our strength work. So like if you want to do this in a sequence, you go for 3 rounds, anywhere between 10 and 20 reps. It's all a bit vague, the range, but it just depends on how much volume that shoulder can take at a time. So once you start to feel it pinching, you can stop, take note of how many you've done at that point, and then see if you can get a few extra reps the next day. First one is the W's. So do these body weight, or you can build this up to a small weight. So forehead is on the ground, elbows by your sides, and then reaching up to fully extended position. So the further off the ground your elbows are, the better for this one. And as I say, this is a kind of more controlled version of the wall slides that you had done. We then have kneeling T-spine. So you're into all fours position. You get your hand behind your head, you bring your elbow to the inside of the other elbow, and then you're going to lift up. So you get a lot of chest opening in this. That should really alleviate that collarbone and chest pain, but it also opens here and it strengthens the back of the shoulder at the same time. Then we have our lateral raise. So you are going, so not straight ahead, not out to the side, but somewhere in between. So you're lifting, similar kind of to the draw the sword that we do in class actually. So you can do it with a band as well, but from here, we're going to lift up and just up to about eye level. As we were saying, if you go above eye level, you are bringing in your trap and not the supra. So just above eye level, and lifting, pausing, and then slowly lowering down. Try not to like lean over to the side. I think that's what we saw in the treatment room. So maybe like record it or look in the mirror, whatever. Lifting and back down. I have one more, don't I? Oh, banded seated rows. I'm sure I mentioned you did these before. You're going to wrap that band around something. That something could actually be your feet as well, if you don't have a banister. So you're sitting nice and upright, shoulders away from your ears, and pull, squeeze, and release. Pull, squeeze, and release. So obviously that will get harder by thicker band or whatever. You can also do that standing. There's a few more variables when you're standing. You can end up bringing your chest and stuff into it. So the more controlled version of that would definitely be the seated. Enjoy.